Hi, I'm Dr. Bryan Baker, founder of the Spine, Hand, and Foot Clinic in Independence, Missouri. I'm a chiropractor, and if you've been following along in this series, we're talking about low back pain. And we started out discussing what kinds of conditions might be inappropriate to be treated by a chiropractor, or what kinds of things you may want to get resolved even before coming to see a chiropractor to assist with your low back pain. Then on the second video, we went into the causes of the cascade of events that result in the symptom of pain that we would call low back pain. Okay, so in the first video, we talked about the pain. The second video, we talked about the immediate cause of the pain, which we defined as the stimulation of neurological receptors of two types, either chemical receptors or mechanical receptors. In this video, I'm going to talk about the chemical receptors, and we'll talk about a couple of different ways that those chemical receptors could be stimulated. Okay, chemical receptors are receiving signals from chemicals in the area, and it's chemicals that generally would not belong in that area. That's what causes the alarm system or the pain to occur. So they're usually inflammatory chemicals. That can happen for a couple of reasons. One is there's some kind of trauma in the area. Trauma in the area could be one of two types. Either there's a recent trauma that caused an inflammatory response, or there's a long-term, low-grade push-pull irritation of the area that's causing chronic inflammation. Or could be in addition to, you could be in an inflammatory state. Your body could be more prone to inflammation than it should be. And honestly, that last aspect is the case, in my opinion, with most Americans, and that's one of the reasons why we as a country tend to be very subject to chronic inflammatory diseases like arthritis and those kinds of things. And that relates very much to our diet. The types of, and this could be a very large issue, and I'm not going to go deeply into it in this video. You can search on the web and find a dramatic amount of information. But the kind of diet that is prevalent in the West creates an inflammatory state in the body. It makes us more prone to inflammation. So inflammation is really not our enemy. I was interested, and I've talked with patients over the years many times about this, in studying pathology in school. We all used a book called Robbins' Pathology, which is used in medical schools and all the chiropractic colleges. And interestingly enough, inflammation is a huge component of virtually all disease processes and pathologies, and that's why the medical treatment for almost everything is anti-inflammatories or steroids to reduce inflammation, because inflammation is involved in virtually all chronic problems and chronic illnesses. Well, but when you study inflammation in Robbins' Pathology, inflammation is described in the chapter called tissue repair and remodeling. So inflammation is actually a very important component of healing of tissue. So if we willy-nilly take anti-inflammatories to stop inflammation, it logically would tell me we're reducing our body's capacity to complete the healing of tissue. Now, I'm not saying that all anti-inflammatories are bad or that you should never take them. I'm just saying that as a mass way of controlling symptoms, anti-inflammatory drugs that stop a natural healing process in its tracks may not be your best answer. Agree or disagree? Okay, so We may be, as a result of our diet, have an inflammatory state in our body that increases or makes us more sensitive to inflammation or more probable to develop inflammation. That's one reason those chemical receptors could be irritated. And the only way to fix that is to change your diet, basically. Sorry. And the second one is if there's been a recent trauma to the area. Inflammation is a reaction to the trauma and really just needs to continue its course and finish the healing of the tissue. So if chemical irritation is the cause, that was the discussion. I was going to go ahead and talk about mechanical, but that's a bit larger subject, and so I'm going to wait for the next video on that. So on the next video, we'll take the second stage of the third tier, basically, of the mechanical receptors and what can be some of the causes of that, and that'll be a much broader subject. We may have 2 or 3 videos just on that. Okay, thank you very much. See you in the next video.